Good afternoon. Thank you, and welcome. My name is Dr. Joan Reed. I'm Dean for Culture and Community Engagement at Harvard Medical School. And thank you for joining us today for the second event in our Opening Doors series, our conversation with Dr. Eleanor Shore. Before we begin, I want to share with you part of Harvard Medical School's Rules for the Road. It's a way for us to support a mutually respectful community. It's this idea of remembering that we're all human, nobody's perfect, we're all here seeking to learn. Invite others in, be respectful at all times. Words do matter. They can hurt and they can heal. Empathy is part of understanding. And that difference between evidence and opinion, each is important, but they are not interchangeable. And please be open-minded. The Opening Doors series presents conversations with HMS faculty members who over time have made significant contributions to the Harvard Medical School. These conversations will ask faculty to talk about their professional journey, including how they first joined the HMS community, changes that they've seen at HMS in the decades since their arrival, and advice for us for recognizing opportunities and dealing with challenges into the future. This series is organized by multiple offices, including my office, the Office for Culture and Community Engagement, but it's also co-organized with the Ackerman Program on Medicine and Culture, the Harvard Countway Library Center for the History of Medicine, and the HMS Center for Bioethics. Today we're honored to be joined by Dr. Eleanor Shore. For more than half a century, Dr. Shore has been a trailblazer, an advocate, and leader in academic medicine at Harvard Medical School. As former Dean for Faculty Affairs and Deputy Director of the HMS Center of Excellence in Women's Health, Dr. Shore's career has been dedicated to advancing all, but also recognizing diversity and gender equity across the medical profession. A pioneer in her era, Dr. Shore was one of just 8 women admitted to her Harvard Medical School class as part of an experiment, and went on to forge an innovative path balancing clinical care, research, administration, and family life. Dr. Shore's story is one of seizing new opportunities, breaking through barriers, and empowering future generations. I'm now going to turn this over to Dr. Grace Wong, who is the HMS Dean for Faculty Affairs, and she will be moderating our conversation with Dr. Shore. Dr. Wong?
Dr. Shore, and actually for the purposes of the interview, can I call you Eleanor? Is that
You
all
may.
right? Okay. This is such a treat for all of us because you essentially had a front row seat to a time of remarkable change. And then I'm going to extend that analogy even further to say not only were you in the front row, but also on the stage, shaping academic medicine as we see it today. So this is such a deep pleasure for me to be here with you.
Thank you.
All right, I'm going to start with some of the questions. And one thing that Dean Reed mentioned was the fact that you were part of this experiment as part of the post-war era between 1945 and 1955 when they experimented, so to speak, with the idea of women joining medical schools. And as she mentioned, you are one of 8 women at Harvard Medical School. And there's actually a much longer video. I encourage people to see it. It's a couple of hours long where you really delve deeply into that experience, but we're going to touch on the highlights. So I was wondering if you could bring us back to that moment, what it felt like to walk into HMS under those circumstances, being one of the very few trailblazers as a woman in medicine. Was there a moment early on when you realized just how unusual that was? And how scrutinized you would be and what your presence would really mean. So take us back a little bit.
I think I wasn't pondering this decision in as weighty a manner as you describe. I was a biology major in college at Radcliffe, very accustomed to being outnumbered, male to female, in every class, and quite liked biology. Thought I applied to 5 schools of biochemistry and was admitted to all of them. And I went to Dr. George Wald, the professor, and said, now how do you decide? You know, here are the choices. He said, you pick the man you want to work with. And I thought, the whole world had just opened up, and I was supposed to pick one man and his research to work with. It just seemed I hadn't experienced enough to be ready to make a selection. So I went home and called the 3 medical schools to see if they would accept late applications because the deadlines were long gone. Tufts and BU said no. Harvard Medical School said yes, and the rest is history.
I love that. I absolutely love that. So, I do wonder at that time where you just mentioned it, the sense of momentousness that you might not have felt then, but then after these major decisions would have happened, then you were thinking about what this meant. So my next question is really about whether you felt belonging and what barriers to belonging looked like. So specifically, during these times where you might have felt that you did not belong, was there something or someone that helped push you through those moments of doubt?
Well, the real truth of the matter is that I met my husband in organic chemistry in college, where in the first exam, we both failed miserably. We could never agree. We both got numbers in the 40s. Neither of us could agree on who got the worst remark, but we then walked from organic chemistry to genetics in the biolabs. And as we recovered from the blow and then learned that you could discount the worst exam that you had, so we knew there was hope, and we began studying together, and the rest is history.
So it sounds like Miles helped usher you through a time where you probably felt like one of very few people. Can you share a little bit about some of the things that he did either to advocate for you or to encourage you behind the scenes?
Well, I think we studied together, and we always sort of ended up, I don't know exactly who won and who lost, but it was always close. And somehow, so it just evolved from sort of supportive organic chemistry to and then he asked me in the Christmas time of that first year that I met him if I would take care of his fruit flies while he went home. What I didn't know was that he left early to visit a girlfriend and left me to take care of his fruit flies. So I lived in Quincy, and I came in by subway, and I took care of his fruit flies and mine. And as the couple weeks progressed, you were supposed to divide them by eye color and then count and work out the genetics. His worked perfectly, and mine were just all over the lot. You could not divide them into any group. I think I replanted the fruit fly eggs 4 times, and by that time I was really getting mad, and I got the instructor, and I said, you've got to sit down with me and let me show you what's here, because I'm not going to do it a 5th time. So he came and sat down And I showed him this array of fruit fly eye colors that just went in succession, but no divisions. And he went back and discovered he had given me a damaged fruit fly, unknown. Not yet, but my husband had one that was just right, and his came out quickly the way it should. And mine ate up that whole Christmas vacation. I was really angry at the time spent. So that was my introduction to science. And why I didn't just go immediately to Greek or Latin or something, I don't know. But I stuck with it in spite of that, and enjoyed each year more.
That's a great example of your perseverance through the odds, even though this one was one that was unintended. And I love also hearing a little bit about that friendly competitiveness that you had with Miles, which
Yes.
kept you along. Can you share a little bit about your interactions with the other women in your class?
We were 8, I believe, and we had one room in the basement of Building A, which they called the woman's room. Other than that, we didn't really bond as a women's group. I think we bonded more with our anatomy teams because we were spending so many hours with the cadaver that it was fun. They were the ones who provided the good company and the jokes and the agonies of the first year anatomy. So it was not, the women didn't bond that much.
Maybe that's actually an indication of how well integrated you were to the rest of the class, potentially?
Well, I think we were all accustomed to being in the minority, and it was no longer a surprise.
I was wondering if we could talk a little bit, and this probably fast forwards your time with Miles, was sort of thinking about a current modern day issue just as much as it was decades ago. So you were managing clinical care and research, administration, family life, and other personal aspects at a time when support systems for women were really nominal. So I was wondering if you could share a moment, a story about a moment where all these roles sort of collided and you had to make a hard choice.
I think, I don't know, there was a moment, but it was a realization that you couldn't do all these things at once. And I got diverted by having spent 2 years in Texas, not far from the Mexican border, and having had a number of Mexican patients, and they mostly came with GI problems, and it was my problem to figure it out and try to treat it and so forth. So I got very interested in what was going on back and forth over the border. And when I got back to the Harvard Health Service, some of my first patients were graduate students who were working on projects far afield. One was working in Alaska, and one was working in Brazil. And they each wanted to be prepared so they could take care of themselves if they got into trouble. So out of that grew a course that we had. I think there were 8 sessions, and they spanned, we would bring some leader in the field, whether it was infectious disease or whatever fields they were interested in, And then they wanted obstetrics because they thought they would be caught in a position where they would be expected to know how to deliver a baby. And I found an obstetrician somewhere who would come, and he showed them the civil defense films left over from World War II with how to deliver a baby in a bomb shelter in your basement or something like that. And so they learned about obstetrics that way. And one went off to Alaska, one went to South America. The one that went to Alaska was in the igloo the night the baby was born and never woke up. So she did not one thing to help in the delivery of the baby. They had it all figured out. The one who went to South America, before she had a chance to use her new obstetrical training, got sick with some infectious disease and left. So all my efforts in that were wasted because nobody delivered a baby from what they learned at Harvard University Health Services. But it did get me interested in travel. And so we started, we developed I don't know what you would call it, not a menu, but a list of the medications that they should all take with them and the instructions of how to use them. And we, I can't remember the number, I think it was 800, but when they got their shots, we would get their name and contact information so that we could contact them when they came home, either after the summer or after a year. And we followed, I think, 800 of them to see, and the comment that I was both amused and annoyed with was the young man who said the threats of disease in India are highly overrated because he didn't get sick. He had so many immunizations that some wore out before he left, and he had to have repeats. And he did not say, "Thank you, health service, for having immunized me so thoroughly." He answered, the dangers of infectious disease in remote areas are highly overrated. But anyway, that started years of working with the travelers, which I greatly enjoyed. And then by and by, I got a master's degree at the public health school and got sent to Saudi Arabia, go out in the desert and try to keep track of, that wasn't easy for many reasons. And, but it was an interesting view of the other side of the world. And then came back and went to the public health school to find out the theory behind what I'd been doing just ad hoc. And from that, I got recommended to be President Derek Bach's assistant for health affairs. He was a lawyer, knew very little about what went on in the medical school. So that became my job, to be sort of his eyes and ears about what was happening here, what things were going to bubble up and cause trouble in Cambridge. And I did that for 8 years. And then I also started work here at the medical school. And the dean, Dan Tostison, said you couldn't work for the medical school and the president at the same time. He wanted total commitment and did not want somebody being the eyes and ears in the medical school to go to tell the president what she saw or thought. So I did that 8 years only, and then came back and started in as assistant dean and associate dean, and then many years later, dean for faculty affairs, which I quite enjoyed.
I'll love to hear a little bit more about that stretch as Dean for Faculty Affairs, because I wonder how many similarities there are from your era and mine currently. But, I'm just going to comment on this wonderful trajectory that you've had in your career. And it's actually what I know of you, which is that you observe things in the world and then you go much more to the next level. You are enabling your trainees to be able to travel, and then you, in many ways, wanted to follow them and get those experiences yourself. So it's nice to see that confirm what I know of you as someone who's always reaching for the highest potential for the opportunity. So let's turn a little bit to that time as Dean for Faculty Affairs. I am wondering, as I mentioned, I'm sure there are many things that are still ongoing now that you had hoped to solve back then. But I was wondering if you could share a little bit about impact as the dean. Back then, how many faculty were there at HMS when you started? About?
Are we talking about all faculty, including instructors and so forth?
Yeah. Roundabout guess?
That's a good question.
Probably a couple thousand, my guess is. Yeah.
And it grew. By the time I retired, there were 12,000, I think.
Well, we're about that, yeah.
All the trainees.
Yes, exactly. Well, I was wondering, from that huge number and thinking about the outsized impact that I'm sure you had on all those faculty, I was wondering if you could actually zoom in to think about a single faculty member or maybe a couple faculty members whom you felt like you had a major impact, either because of an initiative you started or some program that you advocated for.
Well, I'm going to start at the bottom and work up. We had a terrible case of I think he was a resident at the Brigham, who, and I don't recall how it came to light, but it turned out that he was manufacturing all the data just out of his head, not out of the laboratory. He kept monkeys, but that was just camouflage. He was not using the data from the monkeys. And that took up an inordinate amount of time for a year of tracking that down. I really was a detective, not a doctor, and got to be very well acquainted with the legal office at Harvard. We became soulmates trying to work this out. I wish before I came today I'd looked up and seen where this gentleman is. I don't know. But it was inadvertently that patient care, faculty appointments, and then misconduct, it sort of evolved. But it was always interesting. It was never boring.
That is for sure. And it's still the case that, supporting our policies, especially around research misconduct, is a major part of our office. So that definitely has continued. I was wondering, maybe you could share a little bit about the genesis of the Shore Awards. And this is just a PSA for people, which is that we're celebrating the 50th anniversary of the Shore Awards next week. And so we'll be glad to have you back with us to celebrate that. But talk a little bit about how that came about.
It really came from the fact that, so I was doing now clinical care, and I wanted to do, as I say, more in public health and a little more in research. So I went to the woman who was a dean at Radcliffe and had an office on Mount Auburn Street to get advice on how one could prepare for sort of a broader mandate. And she suggested going to the School of Public Health and learning more about legal medicine. And I did, and thoroughly enjoyed the School of Public Health. It was, I was getting a master's degree, and I would sit on the couch at night to try to do the homework. And the youngest of our 3 children, Paul, the oldest, is sitting here in the front row, but the youngest would sit there and color. And so when November came and I did very well on the test, I decided I wouldn't do any homework that night. And I said, Susie, I'm tired. I'm going to bed and I'm not going to do this work. And she said, and who's going to sit up with me while I color? So that's how life sort of, everybody bent to make it somehow fit. It was awkward, but it fit. And I think Paul, who's here, was at the very beginning in kindergarten. And the only thing I remember about that was he was an early reader. And so, but his birthday was November and he was young. And they said, well, if he can read, he shouldn't be in kindergarten. He should be in first grade. And that was September, October, when he hadn't turned 5 yet. And so they finally said, well, Paul, what do you want to do? And he said he wanted to stay in kindergarten because he liked to march. They had music, and marching was his thing. So we all sort of aged together, matured together, and I enjoyed both roles and worked part-time for quite a number of years. I'm coming home mid-afternoon instead of supper time. And by the grace of God, my husband Miles loved to cook. So he would come home, and I would have been in terrible shape if he hadn't liked to cook. But I became the sort of, I don't know what you call it in the kitchen, sort of the support service, you know, taking the dishes away, bringing the dishes in, and he did the cooking, and that worked.
That's a really wonderful window into what life was like with young kids and 2 careers, and again, some really timeless themes here. So what year are you think it was this around the time of? Because I'm wondering if that you could share a little bit about what was happening in academic medicine at the medical school at the time.
Well, let's see. Probably at that time, I think when I first got involved, I can't remember whether there were 1 or 2 women professors. Mm-hmm. And that was, they were considered extraordinary, not role models, but, you know, and 2 of them are up there in the, on those portraits. So that was, I got to watch them from the very beginning of women being in this area, and it crept very slowly. But there were always, I think maybe, I'd have to be sure, but I think in the basic sciences, they got a little ahead in being professors. The I think it was I don't know why, but the women were slower to make it to professor in clinical fields. Somehow it just didn't fit into the culture somehow. And now I get such pleasure at looking at the statistics and seeing how two statistics. One, admission of women to the medical school, and I asked David Nathan once how it always came out 51%, and he had some sort of smooth, evasive answer, but that was a pleasure for me to see it go from one or two humans to 51%. So that was a joy.
Yeah, so you were probably seeing really the upswing of so many things. You did mention how many aspects of being in a large, complex institution like Harvard can feel very glacial. And I was wondering, not just back then, but for now, what wisdom could you share about what it takes to move the needle in organizations like Harvard?
I think it's different in the different faculties. In other words, with the medical school being so far away, that's one thing. The business school had a different model. Derek Bach came from the law school and knew it well, so I never was assigned to the law school, but I was assigned to the other schools to try to see what was happening to the women, the ones. The business school was curious because they were vastly outnumbered, but also rather vocal. So that I don't know what the statistic is today at the business school. I don't know if anyone here does either, but there are a lot of them. That's all I can say.
And then I was wondering, because I'm thinking about all the faculty who crossed your path as mentees or as students or trainees. I was wondering if you could come back and share with us maybe a career trajectory of somebody you mentored directly, either through science or through your clinical work, someone who benefited from your mentorship.
Well, there's a steady stream. It's hard to pick out one woman, one sort of episode. I took care of the grandmother for many decades at the health service when I was the part-time physician there. And she always wanted me to meet her granddaughter, who was pre-med. So I did meet the granddaughter, and she did go to medical school in New York. And then she shows up in my office upstairs to tell me, and she was about to start work in Boston, or maybe had just begun. She was pregnant with triplets. And now that really, we were accommodating to being a parent, but triplets just blew her mind, my mind. She did astonishingly well under very difficult circumstances, and then moved to California. I was very disappointed in that because we'd lived through all of these sort of mind-arresting events, and then for California to inherit her. But she's doing fine.
That's great. I mean, I'm just thinking about the diaspora of faculty whom you've impacted through your programs or advice and so forth. And, I'm sure they circle the world now. So, we've talked a lot about the different identities you've held, and that is as mother and as wife and physician, researcher, administrator, leader. And I was just wondering if you can pick one area in which you would love to have people remember you because of the legacy of the work that you've done.
On the professional side.
Yeah, that would be
Not-
great. Yeah.
I think being Dean for Faculty Affairs was my favorite. I hope if it isn't now that it will become so for you. It's such an interesting mix of the best and the worst, and trying to keep a sense of excellence on the one hand, and on the other trying to mop up all the problems that occur. It was quite a mixture of keeping the two things going at once. But I thoroughly enjoy, not every day, but appreciated. And some days were joyful and some days were not. And you can comment on that.
That's for sure. Yeah, those are good off mic comments we can talk about. But yes,
Yes.
the mix is amazing, isn't it? So, all right, we're closing out our time, and then we're going to turn to our Zoom audience for questions that they may have for you. But I was wondering for our time whether you could share some advice for faculty who are trying to make their way, early career faculty trying to make their way in academic medicine. A piece of advice.
Well, I would say picking an area and a professor, maybe associate professor, but someone in a leadership capacity to work with makes a big difference in getting started. If you just sit there by yourself and nobody's sending you off to meetings or helping you prepare your first papers, that would be very difficult. So I think the capacity for young people to come here, work with faculty, is never to be underestimated.
Those are enduring words of advice around seeking mentorship and sponsorship to really jumpstart somebody's career.
Right.
And I think the wonderful thing is that you were such a part of this school's history in enabling that and providing that kind of mentorship and support yourself. So I thank you so much for this time.
I brought a scroll. Thank you. This was prepared. I don't remember the full rationale behind it, but we prepared this,
Maybe I'll take that edge and then you can take
and let's see, I'll take this. And it was posted in a frame or on the wall outside the Kresge. And I don't know whether it's there anymore or not. I haven't looked. It was the Joint Committee on the Status of Women that made such a difference. I wish I could remember exactly how it got started, but they were women who were sort of joined to make sure that they could thrive in this community. And they did lots of interesting things. But this one I pulled out of my drawer this morning, in which they made this to recognize all of the women who had been coming up to, at that point, the present. I can't tell you for sure what year it is, but I say that the women themselves did an enormous amount to make this a place where women could thrive, because there were many years when they survived, but they weren't thriving. And I give them, the Joint Committee on the Status of Women, enormous credit for not just doing things, but keeping the troubles in the eye of the faculty council. So the dean and the professors had to listen because it kept coming up on the agenda. and it was very persuasive.
And it still continues today. JCSW is very much still an advocate for the women and an organization that can really provide feedback to the dean's office and the university. So I think at this time we will turn to questions that may come up for Zoom.
Dr. Shore, thank you for sharing with us and such a remarkable career and what you have accomplished and laying the groundwork so that many of us who are in the room today could actually even be here today. Can you talk a little bit about some of the people that you felt were your mentor? Were there individuals who mentored you or supported you?
Well, the mentors come across both in setting you towards something and away from something, the different varieties. I had a very fine botany professor who, when I was admitted to Harvard Medical School, took our weekly scientific meeting and devoted it to him expressing his ideas about my career. And he wanted me to know how much time and effort was required to be a good wife and mother. And he really did not think medical school was a good idea. This is a man who had been my mentor for several years. I couldn't believe what he was saying. But he said, turn it down and come work in my lab. And so I went home and accepted Harvard Medical School. But it was a different time, and expectations were different. And he was a good sport about it. He never retaliated for giving up on botany.
Thank you so much for your inspiring interview. I'm Yufei, this year's Shore Award recipient. Thank you so much for your pioneering work and everything for us to be here. I had two questions. One is, I think was asked about the mentor. Another one you touched base on how you balance your work and personal life. I was wondering, can you share more about your how did you set your priority in your life and for your two different careers? Thank you.
Can you?
Well, how you set priorities because of that juggle between personal life and work life. How did you define your goals?
I would say my goal was always to try to do all of it. I never wanted one to capture the other or overwhelm the other. I really liked the combination. My son is here. I don't know whether he wants to object to anything I've said, but I enjoyed trying to have a career. And the career is always, I only worked half-time, which meant I got home at 2 when they were very little. But that made an enormous difference, being able to have a part-time job and part-time at home. My sister, who was a PhD, and I had a plan where we were going to, the idea was one would take care of all the children until noon, and the other from lunch to supper. Little did we recognize that half-time doesn't mean till noon. At the very least, half-time goes into mid-afternoon. So that plan never worked. And I was blessed with finding a woman, to this day, I can't remember how I found her, but Mrs. Colburn came for years and was patient. She didn't have any big mission. She just took care of the kids, seemed to enjoy them, and that made all the difference, getting a until they went to school.
Well, at this time, I think we've reached the end of our hour. And on behalf of Harvard Medical School, Dr. Shore, I want to thank you so much for your decades of service, your inspiration as a role model, and your continued friendship to me and many others here as well. So thank you so much.
Thank you.
I'm reminded both by Dean Wong's comments earlier, but also the last questioner who mentioned that they were a Shore Fellow recipient, Shore Fellowship recipient, and really want to say that that fellowship and what you created has had such a huge impact on the careers of so many, not just women, not just people of color, but on our faculty across the board, and creating opportunities for people to thrive, using the term that you used, to be able to do their best and not feel like they had to give up something that really mattered. So thank you for having that vision, for sticking with it, and making sure that it's something that has remained. And I think for all of us to thank Dr. Shore for what she created.
Thank you.
Your stories are wonderful. We are so fortunate to have had you at Harvard Medical School. I think about my early time here, and I was in your office and groomed by Dr. Shore. So anything that I do well is Dr. Shore's fault. Thank you, Dr. Wong, for being here today. Thank you for moderating this session. We both have so much respect for you and all that you have done. I want to thank your son for also being here. He's been mentioned a lot. And thank you for sharing your mother with us. Thank you for that. Thank you all for being with us today. To those who helped organize this event and sponsor it, the Ackerman Program on Medicine and Culture, the Harvard Countway Center for the History of Medicine, and the HMS Center for Bioethics, and my office, the Office for Culture and Community Engagement. Thank you for being here. Thank you, Dr. Shore. Please join us for refreshments.
Can I share one last memory?
Dr. Shore, you can do anything.
Oh, that's all right. What I'm remembering is our going to Spain, and we had, the women were meeting with the women. I'm not totally sure who was advising whom. We thought we were advising them, but it might have been the reverse. And you came with your daughter, and it was a wonderful event, but I'm not going to remember the magnitude of what happened. I only remembered that your daughter wanted to eat at, what was the restaurant? It was it may have been McDonald's. It was.
She was young.
Yeah, she was probably preschool, and so here was. We thought she'd learn about Spanish cuisine and become bicultural, and every day she wanted to have her McDonald's.
She found the American restaurant.
Yes,
She truly did. But Dr. Shore brought me along for that trip. But I was there with my mother and my daughter. And it was this wonderful time to be with family in this new space. And you are absolutely right. While my mother was going to museums, my daughter was only thinking about, where's the hamburger? Where's the food that I know? But that was another example of your being gracious and kind and opening a door for me in a new way. And I thank you for that. Thank you. Thank you for remembering. Thank you all for being here.